Kimberly, thank you so much for being here.
Thank you for having me.
Apologies for the technical difficulties.
It's okay.
One of the things that you would have heard in the trailer, and hopefully we'll be hearing at the end, if we can play it, is that Kimberly is on a mission to eradicate racism and bias from maternity and infant care. And I would love to have you start by telling us kind of on a higher level what that has looked like for you and how you came to be part of this documentary that is featuring your work.
Yeah, thank you so much. Well, first of all, good afternoon, everyone. Thank you for being here for this important conversation. I often say that I started Earth because I wish I had it when I was giving birth. You know, I was doing all the research, reading all the things, really hoping to have a great birth experience in my city, New York City. And, you know, I come to this work as a journalist by trade, so I always say that so people understand, like, I have a research kind of mind and probably had access to more tools than most folks. So I did all this reading, was really looking into what else was available, whether that was other reviews, at that time, parenting blogs, like all the things. And so I went to Media List, right? I went to a highly rated hospital and walked out wondering what just happened to me, right? Just the level of disrespect, the ways that, you know, the things that I was asking for were ignored. I had a C-section I'm still not able to explain. I said I was breastfeeding. I gave my baby formula against my wishes. It was like on both sides of the spectrum. Everything that I read was a standard practice of care I had to fight for, right? And I, for a while, like really blamed myself because did I do something wrong? Did I miss something in my research? But what I learned as I began to continue my work in maternal health advocacy, that with that experience really activating me, that people are not being treated the same way, even at the same place. And there was nothing about me except my circumstances. The reality was at that time in my life, I was not yet married. And I was in graduate school at Columbia, so I was on student insurance. And so there I was, an unwed Black woman with basic insurance. And I often say that hospital gown is a great equalizer. Like, nobody saw the Columbia degrees or my career in journalism. It wasn't that at all. And so, you know, really, in retrospect, I was like, well, what if I could have read reviews or feedback from people more like me, understanding that perhaps those that I were reading were not particularly helpful for my experience. So, you know, that is really what got me activated in this space. My very first offering to this space was my first book, which came out back in 2007, The Mocha Manual to Fabulous Pregnancy, which really started looking at how pregnancy and childbirth and motherhood is different for Black women. And let me tell you, at that time, people did not want to have that conversation. So I'm really honored to see us here on the main stage and having such celebrated media brands have this conversation out loud.
Okay. Wonderful. Well, so you mentioned you are a journalist by training. You did all the research. You did all your homework. You did everything you could. I think probably everything more than many people do to ensure that you would have the best birth outcome possible, and yet you still didn't. And so that was, as you mentioned, it was a bit of an aha moment and the beginning of Earth. Can you explain to us what Earth is and also the name?
Yeah, sure. So Earth is like the word birth, but we dropped the B for bias, so it's spelled IRTH. And Earth is the first of its kind nonprofit technology platform. We consider it our Yelp for safe Black birth, right? It's a place for Black and brown birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians. We are all about crowdsourcing and publicly sharing where we're getting good care and where we are not, right? And then on the back end, we turn those reviews into data to work directly with hospitals, payers, and providers. What could we learn from the lived experience of Black and brown folks? So we literally help them improve their care, but we hold them accountable. Too much of what's happening to Black women is going unnoticed, and unless you make the media or have a social media following, how would we know, right? So much is lost. And so we want to, one, create a new way for provider selection and saying, you know, what other Black and brown folks are saying about a provider should be a factor in your provider selection, and that includes white women who consider them allies. I hope that many of them will feel that if a provider doesn't have good reviews in our platform, is not treating Black and brown women well, you wouldn't want to go there either, right? And so it really is about thinking about, as you know, as women and folks with, you know, the capacity for reproduction, that we could all use our power in service of those who are disproportionately harmed, right? And so Earth firmly believes, as Black women who have power as consumers in our world, we are not the victims in any Black maternal health crisis. We are actually powerful change agents, and the true crisis is in obstetric violence. And that is what needs to stop. So we're real excited about our potential to leverage the power in our community through technology, but to really help drive change. Too often right now, the tools that are being used just aren't cutting it, right? I don't know if anyone actually believes that an anti-bias training works. There's literally no data that proves that it does. In healthcare management, I have learned that they measure everything, but nobody measures whether the anti-bias training actually removes bias. They just do it. You get to check the box. Many people are just putting the mouse on the cat and moving through the modules. And no one ever checks back in to see if that lived experience of care has improved. And then we have maternal mortality review boards. Now more states are actually analyzing what goes wrong when a mother dies. But we don't think that's a sustainable strategy. We can't try to solve this problem from the grave. So with Earth, we say, let's learn from the living, which seems like a much better strategy if we could actually capture robust lived experience and use that to prevent harm. And that's really what we seek to do. We're now working with health systems in 8 states. We're excited about our expansion, excited to expand more. But this is the next movement in the work.
I wanted to touch on some of those benefits. You started Earth in 2020.
We launched in the app stores in 2020. I started in 2018. We had an 18-month pilot where I just spent my time talking to community in 5 states, really wanting to create a new technology development process of building with community. And then from that process, we ended up being in the app stores.
The full episode of the documentary takes us on your journey and shows some very exciting and inspiring milestones in your journey and Earth's journey. Could you share some of those from being awarded grants to having full-time employees? Can you talk about the growth you've experienced so far?
Yeah, it's been a phenomenal story. I love to share that Earth began as a mother and son project with my son. He has been a math and science kid since he was, 5, 6 years old. He's been to every coding camp, app development camp. They're all expensive and overpriced. And he would come home talking to me in a language I did not understand. I'm like, baby boy, mama's brain is not for that side. I'm on the other side. But I had this idea after traveling for my books and all these other things, because I was hearing the same stories, right? What I was hearing in Detroit, I was hearing in New Orleans, and I was hearing in Oakland. I'm like, how does everybody know that this is not unique to you, right? And I remember I was literally working in New Orleans, and I attended a funeral for a mama I did not know, but I was in community when it happened, and so I went. And I sat there like, I have to do something. And so I said to my son, what if I could create an app? So we started talking about it. We started going to app development classes together. He was like 12 at the time. We went to app development class at NYU, where I'm an alum, so they were free. And he helped create the first wireframes for Earth, and I'm really proud of that. We went to pitch competitions where we would do the 60 seconds, birth, he'd throw the bee out, we practiced, it was like our thing. And we traveled together really with him supporting me in this idea, really as blending our 2 worlds. We got to MIT, my son was there, and that was our first real win at the MIT hackathon. And then because of that, we got some funding. We were invited back to get additional funding. But it's been super exciting. To date, we've probably raised about $3 million in grants to build Earth, to grow the company, to bring on employees. In the film, you'll see the day that I brought in employee number 1. I cried all day. There's a lot of crying. I'm so sorry. But since then, now we have 3 additional full-time employees. You will see in the film me working hard to get 1 hospital to say yes. 1 hospital that we could convince to say yes. Now we have about 8 hospitals in our process and many more in our pipeline. So it's been a phenomenal growth trajectory, and we're doing this as a nonprofit that gets to stay true to this mission, which is all about centering community.
When you think back on all of those wins, what is the most gratifying for you?
Well, I have a broader platform speaking about mothering, and I think for me, the thing that's most gratifying is seeing my children involved in this work. So the birth of my daughter, my first child, really activated me in the space, and then I got to create a solution with my son, right? And so having them involved with the process on both sides has been pretty much, very amazing. And my daughter has she just graduated from Spelman last year, and so yes, I'm a Spelman mom, didn't wear my t-shirt today, and my son is now a sophomore at Amherst College. So like seeing them be a part of the story is one of the most gratifying things. And I think on the product side, just seeing our community's response to what we're doing, to the fact that they are being reminded that their story does matter. I think this is one of our biggest challenges, but also my biggest reward with my community, is that so many times when things happen to us, we just want to move on, right? And then the narrative in Black maternal health is telling a lot of people that they are lucky to be alive, right? Many people have come out, as the hospital will tell them, you're fine, your baby's fine, and they just want to move on. But we've said, yes, that may be true, and whatever happened to you matters, right? And I tell everyone, I promise you, we take every review on Earth, it is read by a panel of moderators, we turn it into data, we are looking on a regular basis to see who needs us to show up and invite them into an improvement plan, who needs us to show up, and when they don't want us to be an improvement plan, we will still show up, right? And so this is the way that we are moving the movement forward. And as I said, we are empowering our community. We are not victims. We are powerful people, and we are proud of how we are leveraging that power.
To that end, what are some of the misconceptions about the Black maternal health crisis that you want to dispel?
Well, I think the most important one is what I said earlier, like we need some reframing, because the crisis is not about Black women and their health, right? And I think there's been a long history of turning Black women into the problem, right? They don't get prenatal care. Well, that was debunked. They don't, they have pre-existing conditions. Well, like I tell people, white women have diabetes and high blood pressure too. I've been to the South, but yet they don't disproportionately die from pregnancy and childbirth. So what we know is that such amazing data coming out showing that even Black women with six-figure incomes, double degrees, have a higher likelihood of dying, and their infants have a higher likelihood of dying than a white woman who didn't graduate high school. So this isn't about socioeconomics, and I think it's really important that we acknowledge that, because if we acknowledge that, then we have to have that important but perhaps uncomfortable conversation about bias and racism. Before, it was really easy to turn Black women to the problem and make it about them, but now that so many studies have shown none of that stuff is true, now we have to get to the root of the matter. We have to start talking about two people are walking into the same place and receiving different quality of care. This is the problem, and this is what we're seeing in our Earth data.
I wanted to take a moment also to change gears a little bit to talk about another project that you're working on, and that is that while you are doing very important and very heavy work with Earth, it's also very important to shine a spotlight on joyful Black birth stories. Can you share what you're working on in that regard?
Yeah, so I'm also the host and creator of the Birthright podcast. On Birthright, we only share joyful Black birthing stories. This was really important. As I mentioned, I'm a storyteller by passion, and I was deeply concerned about this narrative in Black maternal health, which was always focused on doom and gloom. Every headline is somebody dying. It's like all of this doom, despair. And so I wanted to show that joyful birth stories do happen, and we can learn from those too. It's important for my community to know that. We have too many people who are going into birth fearful. That's not the way to bring life into the world. So we want to know that it's possible. We have the Black Birth Joy Line, where it's a free number you can call, where we analyze our transcripts to create an instructional tool for doctors and nurses. What could you learn from Black birthing joy that could teach you something besides for our death statistics? It's really just a disgusting and, for me, unacceptable approach to addressing Black women's issues. And so we're excited about the Birthright podcast as well.
All right. What's one thing that you would like every member of this audience to do today to support Earth and its mission?
Well, thank you so much. First of all, download the app. If you know someone who has given birth, particularly in the last 3 years, as a person of color, please invite them to leave a review. Encourage them, stand by them while they finish. It takes a lot of data points to convince hospitals to listen to Black birthing people. So it is a structured review process. It is not, you can just go on. But, you know, I always tell people, if Geico can convince us that we can save 15%, but 15 minutes, we can take 10 minutes to help make Black birth safer, right? So please download, tell your friends to download. Please support our work. We're a nonprofit, so we're always here for donations, people who want to lend their talents and their gifts to what we're doing at Earth, whether that is on the technology side or the marketing side or whatever. But also to remember that you have a role in shifting this narrative away from Black women being the problem, but the actual challenge being systems. Right? We need to address the systems. So we would be grateful for any and all support.
And where can people learn more about Earth and get the app?
Yeah, so you can download Earth. It's free in the Google Play or Apple App Stores. You can follow us on socials, on Instagram, the Earth app, Twitter, Earth app, Facebook, Earth app. And our website is earthapp.com. And you can learn about it there, and you can find me as well.
Thank you. Well, I encourage everybody to watch the entire episode of The Big Idea that features Kimberly. It's called Birth Without Bias. It's incredibly powerful, very inspiring, very moving. And we can watch the trailer? Perfect. All right.
Here in New York City, the Black maternal mortality rate is up to 12 times that of white women. 12 times.
The statistics are staggering. The disparity in care is costing Black women their lives.
Centuries of poverty and marginalization among Indigenous people.
When I saw how so many Indigenous youth like me get left behind, I was like, this is not fair. For me, the answer was robots.
There are 18.4 million children not getting ASIC vaccinations because of the challenges of the last mile transportation. I was shocked, and then I thought there must be a way to solve it.
We are on a mission to eradicate racism and bias from maternity and infant care.
I want to give students robots who wouldn't have them otherwise. It's a lot.
The goal is to create a reliable cooling device to deliver these life-saving vaccines to the people who need them. Even though I know this is the right thing to do, it's just bloody difficult.
Thank you, Kimberly. You can Google The Big Idea documentary to easily find the episodes. All 3 of them are worth your time. Thank you so much for being here with us.
Thank you.